My name is Amos Adelowo. I am a physician here at Reliant Medical Group with the Department of Obstetrics and Gynecology. I am the Division Director for the Division of Female Pelvic Medicine and Reconstructive Surgery, also known as Urogynecology. Our division here at Reliant, we take care of our patients and women with pelvic floor disorders. This includes women with pelvic organ prolapse or bladder prolapse, prolapse of the rectum, as well as prolapse of pelvic organs such as the uterus. This condition is very common in women as they get older. We see it a lot in postmenopausal women, women after menopause, as well as women that have had children, either just even being pregnant is a risk factor for pelvic organ prolapse. So we have women that have had cesarean sections and still present with having complaints of bulge in the vagina or feeling of something falling out of the vagina. These women are affected by this condition, and this is a quality of life problem. Most women that have this condition complain of pressure in the vagina. They complain of difficulty urinating or difficulty with bowel movement. Some women actually have incontinence of urine or incontinence of stool as a result of the weakness of the pelvic floor muscles that contributes to prolapse. Prolapse by itself is a quality of life condition, so it's unlike other conditions like cancer. It is not a condition that can directly cause death to the patient. Unlike cancer, it is a condition that is bothersome and could affect the quality of life of women. As a result of this, when women come to us with this condition, we discuss treatment options. And some of the treatment options for pelvic organ prolapse does not always have to be surgery. There are some treatment options that include pelvic floor exercises, such as pelvic floor physical therapy, as well as other treatment options such as the use of pessary. What pessary is it's a rubber device that looks like a diaphragm, and this goes in the vagina to hold the pelvic organs up to keep it from falling out. Again, this is a treatment option that is not surgery. It does require maintenance and care, and we discuss with patients what those care involves. It's like a band-aid, and it helps women, especially if they have multiple medical problems and they cannot have surgery. It's a way to treat their prolapse. Other treatment options that we have include surgery, and there are different ways we do surgery. The good thing is now when we do surgeries for prolapse, we're able to do surgery that require patients to not even stay in the hospital overnight. Most patients go home the same day. We do this minimal invasive surgery either through the vagina or through small incisions in the abdomen. And patients are able to either go home the same day or stay in the hospital overnight, and they go home the next day. And they have a speedy recovery. They're up walking around the same day of surgery. They're able to go up and down the stairs. They're able to go for walks. They have minimal restrictions, and their recovery is as minimal amount of pain, thus giving them a good experience after surgery. This is a picture of prolapse, and as it is seen here, it comes in different forms. This is with a uterus coming out of the vagina. It could also be the rectum bulging out into the vagina, or it could be the bladder bulging out into the vagina. So there are different ways that prolapse can present. As a result of that, when patients have symptoms, we encourage them to discuss it with their primary care physician or come to us here at Reliant Medical Group. They could contact us. They could call our numbers at 508-368-3110. That is a direct number where they could talk to someone, let them know what their concerns are, and we're usually able to get them in to see us in a timely fashion. By doing that, we'll be able to talk to them, show them pictures and videos of what their condition look like, and also discuss what the different treatment options that they have. We're always here to help. Please don't hesitate to call us as needed. Thank you.